Can you name a blockbuster therapeutic that has transformed the treatment landscape of multiple diseases? If your answer is yes, then you are likely all too familiar with Dupixent. But if you're not, then let me introduce you to this incredible biologic. In this video, we'll cover everything from its mechanism of action to its recent FDA approval for COPD. Let's get into it. First, some background. Dupixent is a fully human monoclonal antibody that disrupts the signaling of two key cytokines, IL-4 and IL-13. These two cytokines play a central role in driving type 2 inflammation, which is a well-known pathway involved in many chronic inflammatory diseases. By inhibiting these cytokines, Dupixent effectively dampens the immune response and reduces inflammation at the site of action. With over 1 million patients treated globally, Dupixent has evolved from a niche biologic to a true blockbuster across multiple disease areas in dermatology, pulmonology, and gastroenterology. Let's take a closer look at its key indications, market potential, and competitive landscape. First up, we have atopic dermatitis, or AD. This is an immune-mediated skin condition that causes severe itching and inflammation. And according to the market research, the global market size for AD biologics was around $20 billion in 2024. With Dupixent being the first-line biologic for moderate to severe AD, this indication alone represents a significant portion of its overall sales. The top competitors in this space include Adbry, lebrikizumab from Eli Lilly, as well as Xolair, ruxolitinib from Incyte. However, Dupixent remains the dominant player with global sales of more than $6.6 billion plus. Next, we have asthma, specifically the type 2 inflammatory subtype. This is characterized by airway inflammation and hyperresponsiveness leading to recurrent respiratory symptoms. The global asthma biologics market is valued at approximately $25 billion, with about $9 billion coming from type 2 therapies. Dupixent is used as an add-on therapy for moderate to severe eosinophilic or corticosteroid-dependent asthma. Its main competitors include Fasenra or benralizumab from AstraZeneca, Nucala or mepolizumab from GSK, as well as Xolair or roflumilast from GSK. Moving on, we have CRSwNP or chronic rhinosinusitis with nasal polyps. This is a debilitating condition causing nasal congestion and inflammation. The global market for biologics in CRSwNP is worth around $4 billion. And here Dupixent stands out as the only FDA-approved biologic with sustained efficacy in reducing nasal polyps. Other notable players include Nucala, which is used off-label, and Xolair, omalizumab from Genentech, and Novartis, which received approval for nasal polyps in 2020. Next up, we have EoE or eosinophilic esophagitis. This is a rare disorder where inflammation in the esophagus leads to difficulty swallowing. According to the market research, the global market for EoE is expected to reach $2 billion by 2030, and once again, Dupixent takes the lead as the first and only biologic approved for the treatment of EoE. Other key players include Pfizer's etrasimod and CC93538 from Revolutionizing Biotherapeutics, which are both in earlier stages of development. We also have prurigo nodularis, a rare skin disorder characterized by itchy nodules. The global market for this indication is around $1.5 billion. And as the first FDA-approved treatment for prurigo nodularis, Dupixent has a clear first-mover advantage. Although there are other biologics in the late-stage pipeline, such as nemolizumab from Galderma, none have yet reached the market. Additionally, topical agents are sometimes used off-label, but have shown limited efficacy. Finally, we have CSU or chronic spontaneous urticaria. This is a condition marked by persistent hives and can lead to significant discomfort. The global market for CSU is worth around $3.5 billion. And although historically Xolair has been the dominant player, Dupixent recently received approval as an alternative for patients refractory to antihistamine therapy. Other notable competitors include ligelizumab from Novartis, which was withdrawn due to safety concerns, as well as Fasenra and Nucala, which are being investigated off-label in CSU trials. Now, looking at Dupixent's overall market position, total global sales in 2023 surpassed $10 billion, and with peak sales estimates ranging from $13 to $15 billion by 2026, Dupixent continues to demonstrate strong growth. Its broad multi-indication label, consistent efficacy across diseases, and robust safety profile have contributed to its success. However, challenges remain, including its high price point of around $30,000 plus per year, potential payer pressure, and the looming threat of biosimilars, which will enter the market after 2032 when the patent expires. Despite these challenges, Dupixent undoubtedly stands as a benchmark in biologic innovation trends, forming the treatment landscape for various chronic inflammatory diseases. And with that, we've reached the end of our Dupixent deep dive. Thank you for watching, and if you found this video helpful, please hit the like button and subscribe for more content. Until next time.